Hello, my name is Dr. Rudo Benjamin. I currently serve as a board member of Providence Medical Associates, and I am a board-certified physician in adult medicine and pediatrics. I primarily practice as a hospitalist, treating inpatients in the hospital at Providence Little Company of Mary here in Torrance. Currently, I'm also serving as the medical director for Providence's Community Outreach Mobile Van, which provides vaccines, sports physicals, health fairs, and medical care to our neighboring underserved communities. During the COVID pandemic, we vaccinated thousands at churches, mosques, community centers, and even homeless encampments, and continue to provide health care to those who need it the most. I also work at the CCHC, the Coordinated Care Health Clinic, to help aid in transitioning patients from the inpatient setting to home. I love to dip my feet into a lot of different areas. I grew up in the Bay Area, Oakland, California, and then attended undergrad at Harvard University, medical school at the University of Chicago, and I completed my residency training at the University of Michigan in adult internal medicine and pediatrics. After 12 long winters back east, I wanted a change of scenery, sought out greener pastures, decided to come back home, and took a job with Axminster Medical Group here in Los Angeles, which later became a part of Providence. My philosophy of care is a managed care approach, which means coordinating between primary care physicians and specialists to provide the best, most comprehensive care possible. I use a broad-based approach to make sure support systems are in place for patients. As a doctor, my role is to provide my patients with the resources they need and help facilitate communication between doctors for better continuity of care. I joined Providence because it's a non-for-profit, faith-based organization committed to working with the poor and the vulnerable. I started practicing medicine in South Central Los Angeles, and I found that the cultural fit between my approach to medicine and Providence was seamless and just right. I love working with Providence Medical Associates because it allows me the opportunity to become and be the physician I've always wanted to be, working with adults and kids and really using my gifts. I like that PMA supports initiatives such as the Mobile Van program to outreach into underserved communities. I'm a very involved member of the community and love that I have the opportunity to give back. When I was in residency training, my training was more specialty-oriented, and I noticed that primary care physicians didn't really treat patients with more complicated pathologies. But that's not how we approach medicine here at Providence Medical Associates. Our primary care doctors work with complex and challenging cases, and we collaborate with our specialty colleagues to render the most comprehensive care for our patients. I'm proud to say I worked in an intellectually stimulating environment. PMA has a phenomenal group of doctors. I saw that the COVID pandemic has brought us together as a group, and I'm very impressed by how the team pulled together during times of adversity. I feel loved and supported by Providence, and I'm grateful to be a part of this organization. Thank you very much.